Sonda Lawson is the Director of MS Clinical Research and Services at the Michigan Institute for Neurological Disorders, where she helps care for patients with multiple sclerosis. Like the patients she works with, Sonda also has MS, a debilitating and progressive disease that affects 400,000 Americans.
I've seen firsthand the devastation that MS causes, and when TYSABRI became approved in 2004, it represented so much hope for me and really the entire MS community.
The approval of TYSABRI was one of the most significant advances in MS treatment in nearly a decade. But just 3 months after the drug was on the market, its makers, Biogen, IDEC, and Elan, voluntarily withdrew it because of reports of PML, a rare and usually fatal brain infection. After a comprehensive safety evaluation of TYSABRI patients and an advisory committee meeting where TYSABRI's return was unanimously recommended, the FDA has approved the reintroduction of TYSABRI with strong safety warnings and a risk management plan. The addition of this new therapeutic option is exciting news for patients.
There is an analogy I use with patients that any of us can get hit by a bus. The difference is those of us with MS see the bus coming. And if the bus represents disability, then we need treatment options like TYSABRI to slow the bus down.
Dr. Howard Rossman is the medical director for the Michigan Institute for Neurological Disorders. He was one of the clinical trial investigators for TYSABRI.
TYSABRI has been shown to be overwhelmingly effective in multiple parameters in the clinical trials. My own personal experience, which involves both our trial patients as well as our private practice patients, has been quite consistent with this.
Results from a large 2-year clinical trial showing a 42% reduction in disability resulting from MS and a 67% reduction in the frequency of clinical relapses. Based on these significant results and the safety evaluation, the FDA has allowed the reintroduction of TYSABRI.
In general, our patients are ecstatic about the return of another very effective treatment option for multiple sclerosis. However, it is imperative that the physician and the patient work together as a team in assessing the benefit as well as the risk involved in administering this drug.
Celeste Markey was scheduled to receive her first dose of TYSABRI when it was withdrawn. And with today's news, she is again hopeful that she will receive the drug.
Being diagnosed with MS at the age of 13 was extremely hard. Now with new drugs on the market, they give me hope to living a longer, healthier life.
Sonda Lawson shares Celeste Markey's hope for TYSABRI.
I'm really excited about TYSABRI's return to the market. It gives patients more options. It's proven to be an effective treatment, and we're learning how to manage the risks.
I'm Danielle Adair. TYSABRI increases the risk of PML, an opportunistic viral infection of the brain that usually leads to death or severe disability. 3 cases of PML occurred in clinical trial patients who were concomitantly exposed to immunomodulators, interferon beta in the patients with MS, or were immunocompromised due to recent treatment with immunosuppressants, azathioprine in the patient with Crohn's disease. 2 of the cases were observed in 1,869 patients with MS, treated for a median of 120 weeks. A 3rd case of PML occurred among 1,043 patients with Crohn's disease after the patient received 8 doses. The number of cases is too few and the number of patients treated too small to reliably conclude that the risk of PML is lower in patients treated with TYSABRI alone than in patients who are receiving other drugs that decrease immune function or who are otherwise immunocompromised. Healthcare professionals should monitor patients on TYSABRI for any new signs or symptoms that may be suggestive of PML. TYSABRI dosing should be withheld immediately at the first sign or symptom suggestive of PML. TYSABRI is contraindicated in patients who have or have had PML or with known hypersensitivity to TYSABRI or any of its components. Phase 3 placebo-controlled trials of TYSABRI in MS, the overall incidence and rate of other infections were balanced between TYSABRI-treated patients and controls. Herpes infections were slightly more common in patients treated with TYSABRI. Commonly reported infections with TYSABRI included urinary tract infections, lower respiratory tract infections, gastroenteritis, and vaginitis. Serious opportunistic and other atypical infections have been observed in TYSABRI-treated patients. Some of these patients were receiving concurrent immunosuppressants. Incidence and rate of other serious and common adverse events in clinical trials were similarly balanced between treatment groups. Serious events that occurred in TYSABRI-treated patients included hypersensitivity reactions, anaphylaxis, depression, and gallstones. Appendicitis was more common in patients receiving TYSABRI with Avonex. Common adverse events reported in TYSABRI-treated patients include infusion reactions, headache, fatigue, joint and limb pain, abdominal abdominal discomfort, diarrhea, and rash. For more information about TYSABRI, please visit www.biogenidec.com or www.elan.com.
What I see on a daily basis is that the current available treatments, although we're grateful that we have them, are not as effective as what we need them to be.
At this point, our patients are more than willing to follow any guidelines as outlined by the risk map. When I talk to my patients about the potential benefit of taking TYSABRI versus the potential risk that may be present, the response that I receive more often than not is MS is a risk. For me?